we had pharmaceutical companies signing a pledge to, quote, put science first in the race for a coronavirus vaccine. So to chat this and more, we're joined now by Dr. Kanika Monga, rheumatologist in Houston, Texas. So doctor, I want to start with that pledge. I'm wondering if you think that this pledge will go far enough to restore public trust in a vaccine that some fear is being rushed through right now. Dr. Monga, you're muted right now, so we can't hear you as yet.
Thank you. Better?
Yes, we can hear you now. Thank you.
Yeah, so I said, I hope so, right? There's already so much mistrust, so much misinformation about vaccinations. There are people that no matter how good vaccinations are, they're always going to be weary and always skeptical of what's to come. So given this current situation, it gives them another excuse, right? If they're like, oh, this is not undergoing high standards, so why even use it? So I really do think this pledge and making this public is going to make a huge difference in at least gaining trust of a few people.
Now, this pledge comes right after a lot of people raised their eyebrows after the president said, hey, we're going to have a vaccine in time for the election in November.
Right,
and that, of course, caused a lot of concerns that perhaps this pandemic, and particularly the vaccine, was being a little bit over politicized, or just frankly that we were involving politics far too much. I'm wondering what your thoughts are on that. Do you think politics have been too involved and played too large of a role in not just trying to get a vaccine out to the public, but just the fight in this pandemic in general?
Yes, I mean, unfortunately, given this pandemic, it really brings to light how much, unfortunately, politics is influencing science, right? And that should never be the case. A lot of these vaccinations, medications, all of this, the center has to be science, and the center has to be safety and efficacy for the patients and the population. That's the only way to do it. That's the only way as doctors we've ever been trained. So this is really heartbreaking to see that it is getting so, there's so much politics involved with it, and that should never be the case.
So if not the end of October, then when in your mind does the vaccine seem most likely to actually make it to market?
Right. So when I hear, right, guidelines or deadlines saying, oh, we'll have a vaccination out by election date, why is that even? Look, why are we discussing vaccination and elections in the same sentence, right? The number one goal for the vaccination should be that it's safe and the trials have proved that it even worked for our population. So putting it in the same sentence of an election makes no sense to me, right? So my goal, especially looking at now the FDA even said that they're going to insulate the reviewers of the vaccination, protect them from any kind of political pressure, right? So now that really, and I don't think this is anything new. I think they're just reiterating what they would have done anyways, but I think it's so important for them to vocalize that now so that a lot of skeptical people can get on board. So perhaps not by the election, I can't predict when, but hoping at the beginning of next year, but whenever it does come out, right? Whenever or whatever that date is, I want it to be safe for people. And I also want it to work. Otherwise, what's the point?
So I want to switch now to the holiday weekend that we just had. We saw spikes after Memorial Day weekend. We saw spikes after Independence Day. Wondering what your concerns are. If I were to ask you to be slightly predictive, if you had a crystal ball, what you think might be coming in the next 2 or 3 weeks. After we had this holiday weekend, we saw stats out that travel actually upticked almost 1 million passengers a day on just airlines. So when I hear a number like that, I get very concerned that perhaps people were traveling, people were maskless, and we're going to see these numbers start to rise.
Yeah, I do think the cases are going to go up, as we've seen in the past with holiday weekends. Whenever we start getting a little more lax on the requirements, especially just wearing a mask or even maintaining that 6 feet of social distancing, you do see that risk. So I am predicting that cases will continue to go up, especially because of the weekend. Colleges, campuses having a lot of parties and gatherings now, and I think people are just frustrated at how long this pandemic has been ongoing. But the truth is, we need to hang tight because this is very important for us to take into consideration, especially during holidays, that we still need to make sure we're following all those restrictions and guidelines that are important to prevent spread.
So you hinted at something that I want to talk about, especially big in your state. As I had mentioned to everyone, you are currently in Houston, Texas. So Labor Day, I think, is an easy, date on the calendar that everyone marks as when school actually begins. For college students, university students have been in college for a couple of days and weeks now already. And we are seeing news that, surprise, surprise, college students are doing what college students do, which is party, and they're having fun and they're gathering, which of course is not good news for school officials that want to keep their schools open. So 2 questions. 1, do you think, or are you concerned that schools, particularly universities, given that we know college students like to party and have fun, if they're going to become these super spreader locations? And then the second question, I guess, is from a public health perspective. How can schools govern student behavior that is happening off campus at, frat houses, sorority houses? How do you prevent college students from doing what they want to do, which is get together and have a good time?
Right. So very good question. So, I've been a college student before I went to UT Austin. I know a huge part of being on campus and being a college student is to socialize. And that comes innately with being in college. Now, it's unfortunate that the backdrop for a lot of these college students is this pandemic. So it makes it very difficult to figure out what's right and really how to be the most responsible that you can be, but not miss out on your college experience. So unfortunately, I do think if cases continue to rise and a lot of people are hosting parties with hundreds of students, no masks in a small area, then yes, they are going to become sites of super spreading, right? And that is a huge concern. I know a lot of campuses opened up at least a limited classes in person, but still giving that option of online classes. I think if the cases continue to rise and students are not being responsible in the way that they're socializing and not really following guidelines or following sort of the restrictions that should be in place, then I worry that right now, yes, there are a limited number of classes in person. They may take those away altogether. And that would be very unfortunate if everything was turned to just online. And then I believe the second question you asked was how can organizations, especially universities, really govern students, right? It's a catch-22 situation in my mind. For universities, I think they can hold organizations accountable. They can hold, any kind of affiliations with different organizations sponsored by the university accountable. But it makes it so difficult to be able to go into off-campus settings and trying to ensure whether people are meeting guidelines there, right? That becomes so difficult. So I think what colleges or universities are going to do is they're probably going to rely on restaurants, neighbors, perhaps different apartment complexes to monitor their own rules and kind of put into place their own guidelines for the residents of those places or people visiting those restaurants and hosting events.